Have you ever thought about breast augmentation? How it can alter your life, give you confidence, and what are some of the key factors to consider? So what is breast augmentation? Breast augmentation is a procedure whereby we enhance the fullness, the size, and the shape of your breasts. So we can do this by either using implants or by using fat. So when it comes to implants, there are basically two types. We have saline implants and silicone implants. As the name says, saline implants are filled with saline and implants are filled with silicone. So whichever one to choose is dependent on your surgeon and yourself. Another factor to consider is the size. So when it comes to the size, there are different things we should look at. So number one, your body proportion. Something else you should think about is your aesthetic goal, what you would want to achieve from that breast augmentation, and also your lifestyle choice. So for example, if you're physically fit or someone who does a lot of physical activity, that may prevent you from getting a very large breast size or breast augmentation, if I may say so. Those are the two major things to consider when you come in for the consultation. And this is for someone who has chosen breast implants. When we look at the procedure or how this happens, of course, you definitely have to go under general anesthesia. Remember, we said we want to give you amnesia. We don't want you to remember, and we also don't want you to feel any pain. So that's very important. And when we're doing the consultation, we will examine you. We are going to consider where we are going to place the implant, and we have a couple of choices. Depending on your current breast volume, we may decide to place the implant below the gland, and this is called subglandular. If this does not permit us, if you do not have adequate gland tissue, we can opt to put the implant below the muscle or even between the two, that is the muscle and the gland. So this decision will be made with the help of your surgeon when they do the physical examination. In theater, the incision, or where we make the cut, it's usually a very small cut and it's made around the inframammary area. And that's the area where your breast fold ends. So it's around 4 centimeters and it usually heals well. And when you stand, your breast mound will fall onto it. So it will be well hidden. Depending on a couple of things, if you have a lot of excess skin, we may decide to combine the augmentation with a breast lift. But this is again subject to discussion with your surgeon. Aftercare, a bit simple. You will have to wear a bra to make sure that we give you good support. But essentially, breast surgery is quite unremarkable. When we look at fat, because we can use fat as part of augmentation, because there are people who feel like they would want to use their own tissue. So we harvest fat from the belly area or the thigh. We process it and we inject it into the breasts. So with fat, we may have to repeat the procedure a couple of times, because remember, with fat, it is a stem cell and it's your own cell. So if we inject, for example, 100%, we may lose around 40 to 50% with time. And that means you may lose a little bit of volume, and we may have to repeat this fat transfer for you to achieve that volume that you may want. But it's still a good option for clients who do not want to use implants. Those are the two options that we would use when it comes to breast augmentation. So tell me, have you ever thought about breast augmentation? And between an implant and fat, which of the two would you choose? Tell me down below.